Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going to go over Vladimir Putin. Ooh. No politics here, but hashtag support Ukraine. Everybody probably knows who Vladimir Putin is at this point in time. I think he's about 69 years old. He's obviously Russian. A lot of people know him as being more like a dictator, having a very macho kind of outward appearance and being kind of a dictator of a country. So it wouldn't be the first person you think about wanting to get plastic surgery. But there's a lot of rumors and a lot of images going on around about him. A lot of people saying that he had plastic surgery, very suspicious that he did something, or is there something else going on? So we're gonna go through his photos and a little bit of his history, and I'm gonna give you my opinion on what I think he's done. One thing I do wanna say, because I think it's really interesting, is when we look at not just dictators of countries, but also presidents of countries, of any countries, we see them age pretty quickly. Even our presidents, they're in office for only 4 years. We see them aging pretty rapidly in it. So it's a very stressful job, and stress equals accelerated aging. So if we look at people like here we go. Being president or dictator or anything of any country comes with a lot of stress. So even in the United States, and there's only 4-year terms, we can see presidents aging fairly rapidly. And that accelerated aging comes from a lot of stress. So if we look at like President Bush or President Obama or any of them, you'll see that as throughout their terms, they aged pretty rapidly. I think that's one thing that could be going on with Vladimir is that, again, he's a lot of stress. The job comes with a lot of stress, and he might want to be fighting that, looking older and looking like he's aging. So I think that it's just something in general that we notice a lot about presidents or dictators, people that are running countries, because it comes with a lot of stress. And then one other thing I want to say about Russia in general is, as far as stepping into the plastic surgery world, it's fairly new. I think plastic surgery started there becoming accepted as a medical specialty. It was not till about 2009, so that's far less time that they'd be doing plastic surgery there than a lot of other countries, or at least an accepted medical practice. But now we see that it's picking up speed there. In Russia, they're now saying that, I think there was a study in 2016 saying that 1 in 30 women in Russia have had plastic surgery. Don't know how accurate that is, but all I'm trying to say is that plastic surgery is now accepted there, and they're doing it more in Russia. So maybe Vladimir is, partaking in the plastic surgery world. I think just looking at Vladimir in general, between the years of 2000 to 2014, we see some normal aging in him. And then there's some standout points where he was seen on camera at certain events where things look younger, like things had changed dramatically, such as his forehead wrinkles had been significantly reduced. We saw that, I think it was back in about 2011. He had taken some photos, or he was on camera, and there's like, wow, his forehead's much smoother. So it's very suspicious that he had Botox done at some point. And it's probably continuing to do a little bit of Botox here and there. And then I think there was in 2014, he was seen at the Olympic Games, and they said that his face looked much fuller. Now, like I always say, fuller face could be that he gained a bunch of weight or he did something else. But if we looked at his body, we noticed that he didn't gain a lot of weight. So most likely, again, he probably had some facial fillers or some little touch-ups here or there. And I think that's fine. Made him look a little bit younger and a little bit vital and rested. So I think it's very suspicious that he's been doing some of those things starting around that time. So I was looking around online, and I saw a really interesting comparison or photo of Vladimir, which was showing what he looks like now and what he would look like if he hadn't done anything, or what normal change of aging would do to his face. And you would see that at his age, close to 70, he should have more wrinkles in his forehead, kind of bags under his eyes, skin tone kind of changing and graying, a little more wrinkles. So, and we see that in his face now, it looks really smooth. He doesn't have some of those signs in his face. So I am suspicious, definitely, for the things we talked about already, which are Botox, fillers, skin treatments, things like that. And then I think if we look a little bit closer at his face and what we've seen in changes, I do think he's had some plastic surgery. He's not going to come after me either. I'm not worried. I don't know. Just tell you, I don't need any problems, It's scary. So I think looking at his photos, immediately, like I already mentioned, if we're looking at him side by side to some of the changes we see, definitely the forehead's much softer, less lines, less wrinkles, very suspicious for Botox. That mid-face, he looks poofy, he looks fuller. I think he definitely has had fillers put in there. And again, a caveat of that is there is some talk about, could he have an illness? Could he be on steroids? Could he be doing other things? It's possible. I always say you want to look at the body. We don't see many of his shirtless photos right now, or has he gained weight? Is he putting on weight? Is he doing something else? That's possible, but it wouldn't change some of the other things that I see that are different in his face. I think that if we're looking at his eyes particularly, he used to have much more bags under his eyes, so I am suspicious that he might have done a lower blepharoplasty where they go in and take the bags out from underneath the eyes. It looks much smoother and less, like I said, less tired looking. Also, his upper eyes, he used to have a little bit more hangy skin up there, and it looked, again, a little tired. So I think that, again, might be suspicious that he did what's called an upper blepharoplasty, or upper lift to the upper eyelid. And then I think, looking at the rest of him, I don't notice anything else particularly that looks like he had surgery. But I would say the overall look for him is younger and rested. So I think it did achieve what he wanted. Except I do think that people are picking up on a little bit because of the poofiness. So it could be that something else was done, like fat grafting or a slight lift, and he's still swollen from that. Or maybe he is, has some other things going on. But I do think overall looks younger, rested, but slightly poofy. In general, seeing men in powerful positions, men whether in business, whether leaders of companies, whether dictators, whether presidents, I do think that they like to give the impression of strength and youth and vitality. I think that maybe that's what Putin's trying to do. It gives me a reason, again, to be suspicious of that. And I think that is sort of the impression he's trying to give to the rest of the world. So maybe one reason why he would turn to plastic surgery. And overall, like I said, I think it has achieved that, other than if there's something going on and he's little slightly overdone with the poofiness. I think it did make him look younger. It does make him look rested and stronger. So I think overall, if that's what he's trying to achieve, I think he has achieved that to some extent.
You said he's like 69 or almost 70, right? Like, obviously, he wouldn't just naturally age that way.
Yeah, I think, like I said, when we showed that picture, he should be showing a little more signs of aging when he's nearing 70, right? It's interesting he didn't opt for like a hair transplant or something else. Again, that's one big thing for men as far as looking younger and vital is the hair transplant. He doesn't appear to have done that. But overall, I think you would see, a more tired expression, kind of, sort of the things we talked about, more wrinkles, more things in the face. So I think he's definitely doing something.
You talked about presidents, and presidents have 4-year terms here in America, and we see the amount of facial changes that they are subjected to during that 4-year term. I don't know how long Putin has been a dictator, but it's like indefinite, right? So you would never kind of have the quote opportunity, and I don't want to say opportunity because he's choosing to be dictator, but bounce back from that because
downtime.
Because it's constant stress for him rather than put in 4 years or put in 8 years, 2 terms, and that's it.
Right. Well, yeah, and that's maybe also why at certain times he may appear like I think there was a photo that surfaced with a bruise, or a photo where he looked more poofy one time or not one time. That could be because, like you said, he never gets to take a year off, right? So he has to get out into the public, and sometimes it's hard to hide those signs while you're healing, or right after a procedure, you're still poofy. So those are some questions. If he did something recently, it may be why he appears a little more poofy right now, right? If it's not a medical condition or something else going on.